Dr. Janice Dodds. I have my doctorate in nutrition education from Columbia University. And prior to that, I had a master's degree from Tufts University and a bachelor's from Iowa State. All of it in nutrition and focusing on nutrition education. During the course of my career, I actually practiced and studied and practiced and studied. So I worked at the Cook County Hospital as a dietetic education director, and I worked at the University of Colorado Medical Center as a pediatric dietitian. But after my work at Columbia, I became state nutrition director for the New York State Department of Health. And there I was responsible for the nutrition surveillance program and the nutrition bureau. From there I went to the University of North Carolina and taught. And I missed the students that I had been teaching when I was at Columbia and enjoyed getting back to working with graduate students at the School of Public Health. Well, I actually enjoyed my interactions with Genesis Bay because he has a very curious, inquisitive mind. And at the time that I met him, I was really interested in keeping things simple, keeping things basic so that they would not be complicated. Because I think actually eating and food is a very basic, simple thing to do, which our society has made quite complicated. So in talking with Genesis, I found him very receptive to the basic principles. He also shared with me some information that he had about physiology and the body, which I also found very refreshing because of its straightforward nature and simplicity. We talked a fair amount about food labels because I think food labels is a source that everybody can use that help you know what is in your food if you just spend a little time with it. And I was very surprised over time that when he would ask me questions about food labels, or sometimes he even called me on the phone and he said, I have a client here who's asking about this and I need some information about it. And I was very impressed that he had picked that up and that he was using me as a resource to help with that. Well, it was very interesting because I did try it initially, and he was wanting to see, what would happen if he instructed someone and they followed the instructions. And so I was a test case for him. And at first I found some of the foods very unusual, but he was very helpful in helping me figure out what those foods might be and how I could get them. I found the training program to be very appropriate to my ability and to the level at which I was functioning at that point. And so over time it gradually kept getting a little bit more demanding as I developed my own competence. But at one point, we thought that I was type O. But then when I actually got tested, I realized I was type A. And that changed the foods that I was eating. And actually, I found that I liked the type A foods better than the type O foods. So that was a pleasant change, and for me, in some ways, kind of affirms that the type that you are and the foods that are recommended probably fit. Well, I continue to feel that nutrition is just very basic. And over the course of my career, initially the medical profession was not interested in nutrition or food at all. And so we used to have a very hard time as dietitians and nutritionists getting attention of the medical profession. over time, they have become quite interested, and they are actually conducting a lot of research, which is very helpful in knowing more about nutrition. So my interest has really turned to then how does a consumer really eat the foods that are best for them? And I basically go to a very simple formula, and that is to eat fresh whole foods as much as you possibly can. It's great that we have nutrition labels that tell us what are in the foods, but sometimes if it's even more than 6 or 7 items in the food, it's like it's too many, and we've done a lot of manipulation of our food supply in order to make it convenient, in order to make it last a long time, and I think that isn't always in our best interest for our nutrition well-being.
Well, Dr. Dodds, on behalf of EGB Blood Type Based Fitness, we would like to say thank you.
It's my pleasure.